Hi everyone, today we'll be discussing on a topic that is guidance, academic advice, counseling and discipline. So this chapter was just not the last one, just before the last chapter in nursing education and technology, which you will be learning during your 5th semester. So this guidance, it is not just in academics or clinical skill, but it also helps in building the confidence, professionalism and mindset needed to thrive in this field. So this discussion will help you understand how to navigate your course successfully, how to manage your time, communicate effectively and prepare for your future role as a healthcare providers. First, we'll see the introduction. Guidance and counseling play a vital role in the field of nursing education. Guidance is to aid someone who needs help, whereas counseling is a professional help provided to someone who needs help to overcome a problem. So that is a brief difference between the guidance and counseling. So when we speak about guidance, it is you're guiding someone or it is helping someone who needs a help. They need some guidance to move forward. Whereas counseling is, it is provided to some people, they already have certain problems, and in order to overcome such problem, of course you need a counselor, or a counseling is very essential for such person. So that's the thing. Today we'll be mainly discussing on the topic that is related to guidance. Guidance refers to advice, direction or support given to someone to help them make decision, solve problem or achieve their goals. It can be provided by the teachers, it can be provided by the mentors, and of course it is very well provided by the counselors or experts in the various field. So these are the people who can provide the guidance to a person who are in need of a guidance. Moving on to the meaning, guidance refers to the act or process of providing direction, advice or support to help someone make informed decision. So you're helping someone to make a proper decision, so you need a guidance. So when we speak about the meaning, it is an act or it is a process of providing a direction, or you're giving advice or you're giving support to help someone to make a proper decision is a meaning for guidance. Or else it can also be said as achieve specific goals, or you're navigating a particular situation. That is, navigation is you're directing a particular situation. So that is the meaning of guidance. Definition: guidance is a process of helping every individual through his own efforts to discover and develop his potential for personal happiness and social usefulness. So here, just to speak on the meaning of the definition, it is also a process of helping every individual where they need to bring out their efforts. Through his own efforts, they have to discover and develop his potential for personal happiness as well as for the society. So you're just guiding, but the person who is there, he has to bring it out, then only this is successful. So that's the definition of guidance. Anyway, you have to study the guidance definition. You can select any of the definition which is available. So here one definition I have selected is: guidance is a process of helping every individual through his own efforts to discover and develop his potential for personal happiness and social usefulness. So we'll see certain objectives of guidance in education. So there are various objectives listed down. So we'll see one by one the objectives. So whenever you write objectives, it will be always started with the word as to. So we'll see some of the objectives of guidance in education. The first one is to provide information to individual regarding his potentialities. So that is the first one, to provide information to the individual what are his potentialities, to help the individual to gain experience that will help him in making a free and wise choices. Third one, to help the individual in self-direction. Next, to assist the individual to understand, accept and utilize his talent. To help the individual to develop value sense and recognize his aspiration in the light of reality with reference to his strengths and weaknesses. Next, to help the individual to choose educational programs best suited to him. To assist the individual in developing his potentialities to their maximum extent so that he may become what he is capable of becoming. To help the individual to solve his personal problems, to help the individual to make an adjustment to the different life needs, to help the individual to choose educational programs best suited to him, to help the individual to choose the right vocation, that is any occupation suited to his ability, interest, taste and temperament, to help the individual to make a successful adjustment to the environment and to lead a happy and a worthy life. So these are the wonderful objectives which are laid down for the guidance. So if you really take a guidance, or if you are guided by a right person, then of course your life will be as beautiful and as worthy as it is. Moving on to the scope of the guidance. The scope of guidance in nursing education encompasses a wide range of activities and support services aimed at helping nursing students achieve their educational and career goals. The scope of guidance in the various areas are academic advising, career counseling, clinical and practical guidance, personal and emotional support, study skills and test preparation, professional development, research and evidence based practices, cultural competence, leadership and management skills, continuing education and specialty certification, ethical decision making, legal and regulatory guidance, interprofessional collaboration. We'll see each one by one in detail. The first one is academic advising. Nursing students often receive academic advice to help them choose appropriate courses, plan their curriculum, and ensure they meet graduation requirements. Academic advisor can also provide guidance on study strategy and time management. You might have seen in the nursing, we also have a committee called as an academic committee. So this academic committee's main role is to assist the student in helping to achieve their requirements. So there is a curriculum, for example, for you the curriculum is planned by Rajiv Gandhi University of Health Sciences. So they have sent a curriculum, and based on the curriculum you will move forward in your studies. So in order to fulfill the BSc nursing course, each semester you are having a particular subjects and a syllabus laid down. So based on that you are moving forward. So the person who are there in this academic committee, it's their responsibility to guide a student and make sure that they achieve all the theoretical aspect of the syllabus as well as the clinical hours which has been given by the Rajiv Gandhi University. The second objective, the scope is career counseling. So nursing education program offer career counseling to help students to explore different nursing specialties, understand job prospects and make informed career choice. Career counselor may also assist with job placement and provide guidance on resume writing and interview preparation. So the career counseling also can be provided. For example, some colleges have a campus selection. So in campus selection they also give a talk on the career guidance, which specialty to choose, what are the advantages of choosing certain specialty. For example, if you're nurses, so there are once you finish your BSc nursing, at the end, like when you're in the last year, when you're in the fourth year, that is when you're in the seventh and eighth semester, so at that time you are right now preparing to get into the job. So you can choose where you want to work, in which specialty you want to work, whether you want to work in ICU, whether you want to work in MICU, whether you want to get some specialization in working in OT. There are various specialization. So the guidance, for example, each individual has the different talent, different skills. So the guidance will help you which is best suited for your personality. Based on that, it helps as a career counseling. The third one is in the clinical and practical guidance. The nursing student receive guidance and supervision during clinical rotation and practical experiences. The clinical instructors and preceptors play a crucial role in mentoring students, providing feedback and ensuring that they develop a clinical skill and competence. So the scope of guidance is, of course, it is there in the field of clinical or in the practical area. So the nursing students, they will receive the guidance from the supervisor, or through the supervision, the nurse educator or the clinical instructor or the lecturers who are coming into the hospital. So they will be helping you, they will be guiding you what to do, what are the procedures you have to perform, what are the skills which you have to achieve. So here the guidance is very essential. We cannot just take a theory classes and leave you into the clinical area. No, it's not like that. Once we teach something in a theory class, it is also necessary that a clinical instructor should be there in the clinical area. She should teach you in the bedside with a patient how to, for example, how to cannulate the patient, how to insert a Riles tube, how to how to insert a Foley's catheter. So there are various number of procedures are there which has to be really taught in the bedside. So that is the way how you can guide, to guide so that the student can learn a particular skills in the practical area. So guidance will help a lot in the clinical as well as in the practical skills which you are performing in the hospital settings. The next is in the area of personal and emotional support. Nursing education can be demanding and student may face stress and emotional challenges. So, the guidance, counselor or student support services are available to offer the emotional support, counseling and resources in order to manage stress and maintain a mental health. There's a team which is available in order to provide a guidance, so that you will be mentally healthy, so you how to manage the stress. Once you're a nursing student, there are so many things which you have to fulfill on your day to day. There may be a challenges which you're facing either in the theoretical aspect or it may be in the clinical area. It's not only the study matters, there are also other matters which may come into your life during the period of the study. So in order to manage this, there is a team, and this the scope of guidance will fall into this particular area where mental support, how you can manage the stress, will be guided by a person. This is how it falls into an area of personal and emotional support. The next area is study skills and test preparation. Many nursing programs offer guidance on effective study techniques, test taking strategies, and time management to help students succeed academically. So there is also a team which will help you to guide how you have to study and how you can put up the strategies in order to achieve the theoretical as well as the practical skills which can be met in these 4 years of nursing which you have taken as a BSc nursing. So it helps in the matter of the skills and how you can prepare for the exam or any test which you're facing. It may be once you finish your nursing, you may be able to you should be capable of facing other competitive exams, like it may be for IELTS, NCLEX, RN, example hard exam, or DHA, DHO, all this exam, or MOH. So you should be competent enough to face all these exams. So this helps, the guidance helps in this area. Next area is in the professional development. Nursing education includes guidance on professional ethics, standard of practice, and the importance of lifelong learning. Student learns about the code of ethics for nurses and other essential aspects of professionalism in nursing. So when we say about professional ethics, these are the set of moral principles and standards that guide the behavior and decisions of an individual within a professional setting. For nursing student, the professional ethics are especially important because they are the one who deal with the people's life and their well-being. There are some key principles of professional ethics like respect for patient, confidentiality, accountability, integrity, commitment, teamwork and respect. So these are certain ethics which has to be followed by the nurses in order for the professional development. The next area is research and evidence based practices. Guidance is provided on conducting research, critically appraising the scientific literature, and incorporating evidence based practices into the nursing care. So, what is this evidence based practices? Evidence based practice in nursing is the process of using the best available scientific research combined with the clinical experience and patient preferences to make decision about the patient care. The next one is the cultural competence. Nursing education include guidance on cultural competence to ensure that student can provide culturally sensitive and respectful care to the diverse patient population. So the guidance is also required in the area where you're working. For example, the cultural competence. If you're working in India, you should know the culture of India, how they are following, what are the way the lifestyle they are following, what is their diet. For example, if you're just taking the local area like Udupi. So in Udupi, there are people who speak Tulu, who speak Kannada. That is the language which they are speaking, but the culture, there are Hindu, there are Muslims, there are Christians, so they follow the different culture. As well as you have to plan a diet according, there may be in Hinduism there are people who are only vegetarians, they don't eat non-veg. So at that time, you should know what's their culture and what they are following, how they are behaving. So your education or the way you deal with the patient should depend upon the culture. So you should know the culture of a particular area where you're working. If you're going to a western country, you should know their culture, or if you're going into the Middle East, you should know their culture, what they're following. So the guidance will help you. There is also hospitals during this orientation period, which they have 10 to 15 days of orientation period once you join for a job, or even for the student there will be a orientation period, or if you are going to a hospital uh, to as a student, or during your internship posting, you will have a orientation period. So during that orientation period, the cultural aspect is also one topic which will be discussed. So how what are the culture of that particular locality will be said to you. So that is how you can guide a person, that's called as a cultural competence. Next one is in the area of leadership and management skill. As nurse may advance into leadership role, nursing education program may provide guidance on leadership and management skill, including budgeting, staffing and quality improvement. So it will because we are in the nursing field, of course we can take up a leadership quality. So in order to build up a leadership quality, the guidance is also essential. It depends upon the experience, the training, the way how you're trained in order to take up a leadership quality. You can take a higher position in the hospital, like you can be a ward in charge, you can be a nurse manager operation, you can be a nursing director, or you can be a nurse educator, or if you're going to a teaching area, you can be a lecturer, assistant professor, associate professor, the professor. You can be a dean of a college. So it depends. So how you can take a leadership quality, and how the areas how you can do a budgeting, and how you're recruiting, the staffing pattern, as well as you can also manage the quality department. Also you can be a head of a quality department, take a leadership role over there, or you can be take a leadership role in the infection control department. So there are various roles where you can come forward and take it up as a leader. So that's the area which covers the leadership and management skill, where the guidance will be given. Next one, the continuing education and specialty certification. The nursing student receive guidance on continuing education opportunity and the process of obtaining specialty certification in areas such as critical care, pediatrics, or gerontology. So the continuing nursing education and certain specialty certificates you can take when you can take during the time of your course. You can go for a BLS certificate that is provided by the American Heart Association. You can take up that course, you'll get a certificate, but it will be valid for 2 years. Again you have to take up once again. So there are various courses like BLS, ACLS, then NRP, then the critical care certificates where you can take up, as well as you can also attend various workshops which is organized by many of the organization. The seminars will be there, the continuing nursing educations will be there. So it is the guidance should be provided in the area where a student has to take up such programs which will improve their knowledge. So such things has to be done. Even in India, once you finish your BSc nursing, it's written in your certificate at the bottom that you have to update your knowledge, or which is usually called as it comes under the category of staff development. So once you're a staff, it's not that there's an end for your education. You have to attend the CNE programs, the workshops, seminars, and you take a certificate which will give you a few credit hours, and you have to collect all this credit hours for at least the 20 credit hours has to be collected and submitted to the nursing council, that is Karnataka Nursing Council, in order to renew your certificate, because your certificate will be valid initially for 3 years, and thereafter for 5 years the renewal is essential. So in India they have taken the initiative of doing this, but I feel it's still in the process of being implemented. But in other countries, if you go to Middle East, it is strictly and it is mandatory that you should have a 40 credit hours of attending any CNE workshop, seminar. 20 can be online and 20 hours can be offline, and it has to be submitted to the health authority in order to renew your license, or else your license will not be renewed. The next one is ethical decision making. The nursing education emphasizes ethical decision making and guides student in addressing the ethical dilemmas that may arise in healthcare setting. So in healthcare settings, you can see there are many challenges which will be faced, and each nurse should be aware about the standard protocols, the policies, the procedure, uh, the the ethical decisions which she has to make, whether she has to go ahead with the with the decision. So there are various things which she has to keep in mind. There are some examples. I can give you some example for decision making in nursing, like you have to maintain the patient confidential, the confidential matters, informed consent has to be taken, refusing to participate in unsafe practices, advocating for patient, respecting the cultural belief. These are certain example where a nurse has to keep in mind. So for an example of how to maintain a patient confidentiality, it is very essential. And in Western countries, it's strictly they are following the rules of confidentiality. If a nurse leaks out any confidential matter regarding their medical issues, then it becomes a legal issues. So it has to be kept in mind. For example, a situation like a nurse is caring for a patient who has tested positive for HIV. A family member asks about the patient's condition. So, what a nurse has to do? So, the ethical decision the nurse has to take is the nurse politely refuses to share the patient's medical details without the patient's permission, respecting the confidentiality and privacy. The next one is the legal and the regulatory guidance. The students are educated on the legal and regulatory aspects of nursing practice, including licensure requirement and the Nurse Practice Act in their respective jurisdiction. So, as a nurse, there are certain things which she has to follow that will fall under the legal and regulatory guidance. For example, licensing and registration. The nurse must be properly licensed by a recognized nursing council or board. Example, the Indian Nursing Council, or for us in Karnataka, the Karnataka Nursing Council. So practicing without a license is illegal. So if you have failed your nursing and you have not cleared with all your subject, you think that maybe you failed in the final year, it shows that you are not complete and you will be not given any license to practice. So failed students cannot work if at all, if they are working somewhere, because they have studied up till fourth year, they know many of the procedures, they can do it or they can learn it by seeing someone and just practice without the license, but that is not proper, it is illegal. So such things has to be kept in mind, like and also the nurses should keep in mind the scope of practice. So what they are allowed to do, that much only they should do. It's not like you can take up the doctor's role and perform like a doctor. For example, there are so many nurses who can give anesthesia. So they have learned how to give the anesthesia. It doesn't mean that the nurse can go forward and be an anesthetist, like play a role of an anesthetist. No, that should not be practiced. So there are so many examples like that. So the nurse should know what they have to do and what not. So they should not fall into practicing illegal things. So these all comes under the guidance of legal and regulatory guidance. The next one is interprofessional collaboration. The nursing student often include guidance on collaborating with other healthcare professionals to provide a comprehensive patient care. So the today's trending is the collaboration is very essential in order for the well-being of a patient or to plan properly for a patient. I'll give you one example. For example, managing a diabetic patient. So, a nurse caring for a patient with uncontrolled diabetes, to provide the best care, the nurse collaborate with doctor. So, the doctor will adjust medication and monitor blood sugar level. The dietitian to plan a diabetic friendly meal plan. Pharmacist to ensure safe and correct medication use. Physiotherapist to create an exercise plan suitable for the patient. The social worker to address any financial or home care support needs. So, here the result is the patient receives holistic, well coordinated care that improves their condition and quality of life. So, for each the patient, according to the diagnosis, the nurse should take up a role in coordinating the team members. There are different teams available in the hospital, so it's her role to coordinate with all these people, so that coordinated care will help to give a holistic care to the patient. Hence, the scope of guidance in nursing education is comprehensive and designed to support students' development competent, compassionate, and ethical nurses. It aims to prepare them for complexities of modern healthcare while promoting their personal and professional growth. Europe. Moving on to the next heading, that is purposes of guidance. So, we'll see certain purposes to achieve a clear understanding and acceptance of himself or herself, his or her strengths, limitations, interests, aptitudes, skills, abilities, attitudes, and drives. To develop his abilities and interests to the extent possible by providing him appropriate experience. To understand the choices he faces, the opportunity opens to him, and the qualification required for the goal he sets. To make his own decision and plan based on self understanding, a knowledge of the choices opens to him. To act on the plans he has developed and to achieve adjustment in the new situation. To accept the responsibility for his own decision. Moving on to the next slide, that is principles of guidance. Principles of guidance provide a framework by effectively supporting individuals in various aspects of their personal, educational, and professional development. These principles will guide educators, counselors, mentors, and advisors in helping individuals make informed decisions, set and achieve goals, and overcome challenges. Let's see the few listed principles of guidance: client centered approach, respect and empathy, active listening, goal oriented, informed decision making, holistic approach, developmental perspective, strength based, cultural sensitivity, confidential, ethical practice, feedback and assessment, collaboration, continuous improvement, and documentation. So, the first principle which has to be kept in mind, it should be a client centered approach. So, guidance should be tailored to the unique needs, goals, and circumstances of the individual who is receiving the guidance. It's essential to consider their preferences, values, and background when offering support. So, when you're going to give a guidance, it should not be that what you say is the right. It's a thing that you have to the person who is receiving the guidance, their preferences, the values they follow, the background about them, and all the other things surrounding them based on them. So whatever the guidance which you're going to give should fit to them so that they can follow it, then only it can be taken forward. So the first principle which has to be kept in mind is a client centered approach. It is not the person who is giving guidance, it's not their importance, it's important of a client, so it's called as a client centered approach. That is the principle which has to be kept in mind. One more principle which has to be taken into consideration is respect and empathy. So, when performing or when you're giving a guidance, the practitioners of guidance should treat each and every individual with respect, empathy, and should be non judgmental. Creating a safe and supportive environment encourages to open communication and trust. The third principle is active listening. Effective guidance involves active listening, where the counselor or advisor pays a close attention to what the individual is saying, asks clarifying questions, and shows a genuine interest in their concern. So, this is the best principle which has to be followed by a person who is guiding a person. So interest plays an important role. So whatever the person is saying who requires a guidance, so whatever they are saying, you should be actively listening to what the person is saying, and based on that you can guide an individual. The fourth principle is goal oriented. Guidance should help individual set a clear, achievable goals and develop a action plan to reach these goals. This include identifying a short-term and long-term objectives. So this is one more principle which a person who is guiding should have in their mind, that it should be goal oriented. It may be a short term goal or along with that a long term goal. Both has to be planned. The next principle is informed decision making. One of the central purpose of guidance is to provide individual with accurate, relevant information so they can make an informed decision. This might involve providing educational, career or personal information. The next principle is holistic approach. Holistic means in all the dimension. So guidance should address various aspects of an individual life, which includes academic, career, personal, emotional well-being. So you have to consider all this dimension. So taking a holistic approach recognizes that these aspects are interconnected. When you plan something to an individual, it does not mean that the individual is going through only one aspect of the life. So there are various other aspects of individual's life. It may be an academic performance, it may be their own emotional status, it may be their personal problems which they are facing either in the college or at home. So it depends. So there are various aspects. So all these things has to be considered when you're planning something for an individual, as these are all interconnected to an individual. The next principle which has to be kept in mind is a developmental perspective. So each individual has the developmental stage. So the guidance should consider an individual's developmental stage and readiness for the change. Different age group and life stages have a unique needs and challenges. So as you all know, since from the childhood till the old age, there are various stages which comes in each individual's life. So each life stages has their own challenges. It has its own way of dealing with the own way of dealing the life process. So the person who is guiding an individual should understand what are the psychological development, the physiological development which is occurring during those particular stages. Based on that particular changes, you should know their characters, the development, the physiological changes happening in them, the mental changes. Based on that, the guidance has to be given. So the developmental perspective is one of the principle which has to be kept in mind when you are guiding a particular person. The next principle is strength based. Focus on identifying and leveraging, that is, use something to a maximum advantage, an individual's strength, talents, and abilities. This positive approach can boost self confidence and motivation. So, whatever the strength the individual is having, you should identify the strength, and based on that, you should explain to the patient that you should take the maximum advantage of what the strength or the person is having an ability to do, or the talents. Like for example, some are very good in IV cannulation, some are very good in doing the endotracheal intubation. So know who are skilled enough in doing certain things. Some nurses are very good in IV cannulating for neonates, the newborn. So it depends. So you have to identify the abilities of the strength of a particular individual. Based on that, you have to give a guidance, so it becomes a positive approach, so you can boost the self confidence and motivate an individual. So that's called as a strength base. So that principle also has to be kept in mind. The next principle is cultural sensitivity. Recognize and respect cultural, ethnic, and diversity, related factors that may influence an individual's beliefs, values, and decision. Cultural sensitivity is crucial for effective guidance. For example, in nursing, respect for diversity. So once you're working in an hospital, recognize and respect difference in language, religion, custom, food, health belief, family roles, and also avoiding assumption and bias. Do not assume that everyone shares the same beliefs or values. Nurses should listen and learn from patients' experience. So this is one of the principle which has to be kept in mind when you are guiding a particular person. So you should know the values, their beliefs, their customs. We cannot generalize everything for everyone. So you have to treat each individual in a different way, and the cultural sensitivity also has to be kept in mind during the time of guidance. Of course, the next principle is confidentiality. Maintaining confidentiality is essential in guidance to build trust and ensure individuals feel comfortable discussing a personal and sensitive matters. Confidentiality is one of the principles which has to be followed, because we should not discuss the people's issue if actually it has to be kept confidential. For example, if we are taking a clinical teaching, during a classroom discussion, suppose a nursing student shares a personal clinical experience involving a patient from their hospital training. While discussing the case, the student accidentally mentioned the name of the patient, the full name of the patient, and specific details. But that becomes a issue, that is an ethical issues. So it shows that there is a breach of confidentiality, because the patient identity and personal health information should never be disclosed, even in an educational setting. So here the corrective approach is the nursing student and the educator must discuss the clinical cases without revealing any identifiable patient's information. For example, the name, the patient's name, the hospital ID, or certain specific details which should be kept in private, has to be kept in private. For example, if the patient is HIV positive, in such cases these things has to be kept as a confidential, or else it becomes a breach of confidentiality. The next principle is ethical practice. Guidance professionals should adhere to ethical standards and codes of conduct in their respective fields. Ethical practice ensure the well-being and right of those receiving the guidance. Ethical standards and code of conducts are a set of guidelines that help nurses act with honesty, integrity, and professionalism while delivering a safe and compassionate care. For example, the respect for human dignity, autonomy, beneficence, justice, confidentiality, accountability. So these are few examples for the code of ethics. So the nurses has to keep in mind all these things during her professional period. The next principle is feedback and assessment. So regularly provide constructive feedback and assessment to help individuals gauge their progress and make necessary adjustment to their plans. Feedback plays a very important role, that whatever the guidance you have given, it's not that in one session you can do it. There should be a regular feedback and assessment has to be done, and this principle also has to be kept in mind during the process of guidance. The next principle is collaboration. Collaboration with other professionals such as educators, therapists, or career specialists can enhance the effectiveness of guidance service. Interdisciplinary collaboration ensure a comprehensive approach to support. So the collaboration plays a very important role, like interdisciplinary. You are involving the other person also in the guidance. The next principle is continuous improvement. The practice of guidance should evolve to meet changing needs and challenges. Guidance professionals should engage in ongoing professional development to stay current and improve their skills. The last principle is documentation. Maintain accurate records of guidance which you have given, the guidance session, the goals, the progress, and decisions. Documentation helps to track an individual's journey and provides an historical perspective. So whatever the things you have done in each session, whatever the guidance which you have given, make sure that you document it. So document will help you to know how many sessions you have taken, what were the goals you have planned, and how the progress is going on, and what decisions you have taken. So it helps for in order to track the journey, and also it provides an historical perspective. So we have seen these 15 principles of guidance. So these are the 15 principles which has to be kept in mind when you are guiding a particular individual as a guidance professionals. Fine. We are moving on to the types of guidance. So there are various types of guidance, how you can guide the group of people. So in that, the first one is educational guidance, vocational guidance, personal guidance, social guidance, a vocational guidance, and health guidance. So these are different types of guidance, how you can plan a guidance for an individual. So, what do we mean by educational guidance? Educational guidance is concerned with assistance to be provided to the pupils which are expected for their adjustment in schools and selection of curriculum. It is defined as a conscious growth of the individual. This has to do with knowing his interest, selection of his subjects, and the form of his study habit. So that's the educational guidance. What education you are going to take up. So in that path, a guidance is given, which we call it as an educational guidance. The second one is a occasional guidance. Occasional guidance is concerned primarily with helping individuals make decisions and choices involved in planning their future and career decision and choices necessary in effecting satisfactory occasional adjustment. Occasional guidance would assist an individual in solving this problem. So it depends upon what you're going to do, what is your career in the future. So how you can pick up, how you can make a choice, which choice about of your future as a career. Third one is personal guidance. The personal guidance assists the individual to adjust to the psychological and social environment. It is to solve emotional and psychological problems. So you are giving guidance personally to an individual in order to adjust themselves either to the society or mentally, so psychological as well as a social environment. The next one is the social guidance. Society and people from different socio-economic status, linguistic, socio-cultural background, they come to study here. Students sometimes may face problems in adjustment and social relationship and in becoming tolerant towards others. So you might have seen in nursing, many people come from Kerala, some people come from Tamil Nadu, the Karnataka. So if you go to north side, still you can see the Keralites will be there, the North Indians are there. So they have the different language, their culture will be different. Some get adjusted very well, and some cannot adjust to the different group of people. So this social guidance will help you, will guide you how to get adjusted to the situation. That's called as a social guidance. The next one is evocational guidance. Here, an individual spends only a small portion of his time, that is like 4 to 6 hours per day in school. The rest of the time need to be effectively managed and utilized by the child for his or her progress and development. A vocational guidance helps the child to judiciously utilize this leisure time. So you will spend most of the time at home, like in a day if you have 24 hours, maximum 6 hours or maximum to 8 hours you may spend in the college. The remaining things, even though your 8 hours, the 6 hours class will be taken, remaining hours you don't know what to do. So a vocational guidance will help you how you can effectively utilize these hours. So that's called as a vocational guidance. The last one is health guidance. Health is regarded as wealth. Total health, that is preventive and curative, is the goal of the health guidance. So, health guidance role is they will guide you how to be healthy. So, that is the main goal of health guidance. So, we have come to the end of the topic, the guidance. That's about the guidance. In conclusion, guidance in nursing plays a vital role in shaping competent, compassionate, and confident healthcare professionals. It helps nursing students not only develop their clinical skills but also understand the importance of ethics, communication, cultural sensitivity, and professional behavior. Through proper guidance, students are empowered to face challenges, grow in their roles, and provide high quality patient care. As future nurses, embracing guidance with an open mind and a positive attitude is the first step towards becoming truly successful and responsible caregivers. Thank you.